reprise de débat.
The Honourable Parliamentary Secretary to the Minister of Citizenship and Immigration.
Merci, Monsieur le Président. I rise today.
Thank you, Mr. Speaker.
E14, and I start with reference to the Carter decision, which we have heard much about from the Supreme Court of Canada. Mr. Speaker, in the opening paragraph of that ruling, the unanimous court said, and I quote, "It is a crime in Canada to assist another person in ending her own life. As a result, people who are grievously and irremediably ill cannot seek a physician's assistance in dying and may be condemned to a life of severe and intolerable suffering. A person facing this prospect has two options. She can take her own life prematurely, often by violent or dangerous means, or she can suffer until she dies from natural causes. The choice is cruel." Mr. Speaker, I agree with the Supreme Court. The choice is cruel. The Supreme Court concluded that the criminal law as it currently stands is not only cruel, it is also unconstitutional. The Court found that Section 7 of the Charter requires access to medical assistance in dying, subject to certain safeguards. And that is where this House finds itself today. So let us be clear, Mr. Speaker, the question facing parliamentarians is not whether we should permit Canadians access to medical assistance in dying. That access must be permitted to comply with the Charter. The actual question facing us is how to design the access. And in terms of design, Mr. Speaker, I believe Bill C-14 strikes the right balance. The balance is between the right, on the one hand, of a competent person who seeks an assisted death in response to a grievous and irremediable condition, as compared to the need to protect the vulnerable from being induced to commit suicide at a time of weakness. Striking this balance is not simple, Mr. Speaker, nor is it permanent, and this is an important point. The balance must be calibrated and recalibrated according to changing evidence and the evolution of societal values. Indeed, the Supreme Court's 2015 decision, which reversed the Court's earlier ruling in 1993 in Rodriguez, is evidence of this very evolution. But for now, Mr. Speaker, in terms of where we are in 2016, I'm firmly of the view that this bill strikes the right balance. But there is another reason why I rise before you today, Mr. Speaker, to speak in favour of the bill. That's because I've spent my career as a constitutional litigator, fighting for people's rights, their human rights, their charter rights, their right to equality. Treating people equally means treating people with respect, according them dignity and according them autonomy. That's what this bill does, Mr. Speaker. It gives people control over their own lives, including the conclusion of their lives. It allows those nearing death to pass in a manner of their choosing with less suffering. In empowering choice, Mr. Speaker, this bill empowers Canadians. It strengthens us as a people because it is informed by a desire to give Canadians more autonomy and, as a result, greater dignity. Monsieur le Président,
Mr. Speaker, for the remainder of my time, I'd like to address two broad categories of concern about the bill. Namely, critiques on the one hand that C-14 does not go far enough in rendering medical assistance in dying available, and secondly, critiques to the contrary, that the proposed legislation goes too far in making medical assistance in dying too accessible.
Category, Mr. Speaker, the concerns are that Bill C-14 is not broad enough. They center on three main components, and we've heard some of them this afternoon and in previous days of debate. For now, Mr. Speaker, it is proposed that medical assistance in dying only be permitted for adults and for those who suffer from more than a mental illness alone. In addition, for now, Bill C-14 does not provide for advanced directives regarding medical assistance in dying. Now, the words I've used for now, Mr. Speaker, are important. The government has committed to an independent study of legal, ethical and medical issues that are raised by each of these three different categories. This is important because if medical assistance in dying is to be expanded into any of these three areas, it must be done only after comprehensive study of the benefits and the risks associated with permitting medical assistance in dying in such circumstances. I was determined to hear from my constituents directly on this important legislation, Mr. Speaker, so in early April I hosted a town hall in my riding on the issue of medical assistance in dying, right in Parkdale High Park. The engaged constituents of my community came prepared with thoughtful and personal reflections, with concerns and with questions, many of which relate to these very three items I just raised. While the residents and community, like me, Mr. Speaker, are keen to protect and promote the autonomy and dignity of all Canadians, including youth and the mentally ill, the residents of my community also cautioned about moving too quickly in an area where the consequences of a decision are final and irreversible. They noted, for example, that in Belgium, medical assistance in dying had been legalized and studied for a period of 12 years prior to medical assistance in dying being made available to minors. The mentally ill, it was noted, will be able to avail themselves of medical assistance in dying under this legislation, provided their mental illness is part of the patient's overall medical circumstances, and that the applicant is still able to meet all of the general eligibility criteria. As one who has championed the rights of mental health consumer survivors in my community, Mr. Speaker, I know it is critical that before embarking on the path of increased access to medical assistance in dying, for those whose condition is mental illness alone, that we get this right. And as we've said repeatedly, Mr. Speaker, our government believes in enacting legislation that is well-reasoned, carefully analyzed, and based above all on sound evidence. The proposed independent studies into things like access for minors will help inform this analysis and critical evidence-building process. Importantly, Mr. Speaker, Bill C-14 also contains a provision which calls for a mandatory review of the entire legislation every 5 years. As I said at the outset, Mr. Speaker, finding the right balance in legislation of this nature is not permanent. It's fluid. It's a dynamic process which can and must adapt to changing evidence and societal norms. In the Bill C-14 is not extensive enough category, Mr. Speaker, we also find an argument relating to reasonable foreseeability. Again, we've heard questions about this afternoon. Some assert that the requirement of Bill C-14 that a person's death must be reasonably foreseeable is an unnecessary barrier. Such concerns are unfounded. Bill C-14 is actually more permissive than any assisted dying legislation in North America. In Quebec, an applicant must have a terminal disease. C-14 is more accessible. It would allow medical assistance in dying where death is foreseeable, reasonably foreseeable, looking at the totality of the medical circumstances. In addition, in each of the 4 American states that have legislated medical assistance in dying, one is required to have a specific prognosis that an individual has less than 6 months to live. There is no such temporal restriction in Bill C-14. Finally, in the category of Bill C-14 is not quite broad enough, some contend that the bill should stipulate, and we've heard this again this afternoon, that medical practitioners are professionally bound to provide such service. This criticism misunderstands the nature of Bill C-14. It's an amendment to the Federal Criminal Code. It's also misguided jurisdictionally, Mr. Speaker, so wearing my constitutional hat, it is clear that the federal government has an important role to play in maintaining universal access to insured health services. But the ultimate delivery of medical services is primarily a matter of provincial jurisdiction. Our government, as was mentioned by my colleague, has committed to work going forward with provinces and territories to support access for medical assistance in dying, while simultaneously respecting the personal convictions of healthcare providers. This approach reflects the balancing that must occur when you're addressing competing charter claims. On the one hand, Mr. Speaker, the Section 7 claims of those who seek access to medical assistance in dying must be balanced with the freedom of conscience rights that are entrenched in Section 2A of the Charter, and those are the freedom of conscience rights of healthcare providers. The Supreme Court recognized this in the Carter decision in paragraph 132, and this bill recognizes it in the preamble. Mr. Speaker, that second broad category is that the bill is too permissive. D'autre part, Monsieur le Président, sont ceux.
On the other hand, Mr. Speaker, are those who contend that Bill C-14 is too permissive, that it fails in the fundamental duty to protect vulnerable persons from being induced to commit suicide in a moment of weakness.
Medical assistance in dying is not simple, nor should it be. Requests must be made in writing. This has a meaningful impact. All such requests must be witnessed by 2 independent individuals. They cannot be a beneficiary in a will or a person charged with the care of the ill individual. A request must then be approved in writing by not 1 but 2 different medical practitioners. Finally, the bill calls for a mandatory waiting period of 15 days in order to allow individuals to reflect on the seriousness of this choice. Mr. Speaker, the bill goes further. It requires an extensive regime of monitoring so that data and trends respecting medical assistance in dying can be obtained and analyzed by government. This kind of monitoring will ensure transparency, but more importantly, it will facilitate strengthening safeguards where required. Mr. Speaker, finally, I'm encouraged by the fact that Bill C-14 not only reflects the significance of choosing medical assistance in dying, but that every choice ought to be an informed one. By this, I'm referring to the pressing need to enhance palliative care in Canada, a need expressed to me time and time again by residents of my riding of Parkdale High Park. If we were to ensure that the significant choice of requesting medical assistance in dying is fully informed, it is critical that we work collectively in a nonpartisan manner to ensure that improved palliative care is readily available. In conclusion, Mr. Speaker, I reiterate that this proposed legislation is neither too restrictive nor is it too permissive. It strikes the correct balance while simultaneously recognizing that with further study and mandatory review, the balance will continue to be recalibrated to reflect new evidence and evolving societal values respecting medical assistance in dying. Most importantly, Mr. Speaker, this bill eliminates the cruel choice that the Supreme Court described in the opening paragraph of the Carter decision. No longer will grievously ill Canadians be faced with either taking their own life prematurely or prolonged suffering until they die. Bill C-14 gives such Canadians what the Charter requires: autonomy, Mr. Speaker. It gives them control over their passing in a manner that ensures their dignity. For this reason, I'll be supporting this legislation. Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. Speaker.
Questions and comments? The honourable member.